Hello everyone, and welcome back to our channel The Future. Today's video is a bit different. We're going to have a candid and important conversation about depression. It's a topic that affects millions of people worldwide, and it's crucial that we understand it better and learn how to support ourselves and others. If you or someone you know is struggling with depression, this video is for you. Let's dive in. Segment 1. Defining depression. First things first, let's clarify what depression is. Depression is not just feeling sad. It's a complex mental health condition that affects a person's thoughts, feelings, and behaviors. It can persist for weeks, months, or even years, and it can interfere with daily life. Depression is a mental health condition characterized by profound feelings of sadness and despair that persist for an extended period of time. It can significantly impact a person's life, leading to changes in their emotions, behavior, and thought patterns. Common symptoms for individuals experiencing depression include 1. Persistent and deep sadness, a strong and enduring sense of sadness and melancholy that lasts for an extended period without an apparent cause. 2. Loss of interest and pleasure, an inability to find enjoyment in activities and hobbies that were once pleasurable. 3. Changes in sleep patterns. Depression can lead to alterations in sleep patterns, including insomnia or excessive sleep. 4. Changes in appetite and weight. Increased appetite and weight gain or decreased appetite and weight loss are common. 5. Fatigue and lethargy. A pervasive sense of fatigue and exhaustion, even after completing simple daily tasks. 6. Low self-esteem and self-confidence. Feelings of helplessness, anxiety, and doubt in one's own abilities. 7. Social withdrawal, social isolation, and a lack of desire to interact with others. 8. Suicidal thoughts. In severe cases of depression, thoughts of suicide may emerge. It is essential for individuals suspected of experiencing depression to seek professional help from a psychologist or psychiatrist for proper assessment and treatment. Depression is a treatable condition, and with the right therapy and support, individuals can experience significant improvement in their mental health. Segment 2. Common signs and symptoms. Depression can manifest in various ways, and it's important to recognize the signs. Some common symptoms include persistent sadness, loss of interest in activities, changes in appetite and sleep patterns, fatigue, and feelings of worthlessness or guilt. Common signs and symptoms of depression can vary from person to person, but they often include a combination of the following. 1. Persistent sadness, feeling consistently sad, empty, or down for most of the day, nearly every day. 2. Loss of interest, losing interest or pleasure in activities or hobbies that were once enjoyable. 3. Changes in appetite or weight, significant changes in appetite resulting in noticeable weight loss or gain. 4. Sleep problems, difficulty falling asleep, staying asleep, or experiencing excessive sleep, hypersomnia. 5. Fatigue, feeling persistently tired, even after a full night's sleep. 6. Difficulty concentrating, finding it hard to focus, make decisions, or remember things. 7. Feelings of worthlessness or guilt, having negative self-perceptions, feeling guilty for no apparent reason, or being overly self-critical. 8. Irritability, becoming easily irritable or having a shorter temper than usual. 9. Physical symptoms, experiencing unexplained physical ailments such as headaches, stomach aches, or body aches. 10. Social withdrawal, withdrawing from social activities, friends and family, and avoiding previously enjoyed social interactions. 11. Low energy, feeling a lack of physical and mental energy, making even simple tasks feel exhausting. 12. Thoughts of death or suicide, having recurrent thoughts of death, dying, or suicidal ideation. 13. Agitation or restlessness, feeling restless, agitated, or on edge. It's important to note that not everyone with depression will experience all of these symptoms, and the severity can vary widely. Additionally, depression can manifest differently in men, women, and individuals of different ages. If you or someone you know is exhibiting signs of depression, seeking professional help from a mental health provider is crucial. Depression is a treatable condition, and early intervention can lead to better outcomes. Segment 3. Causes and triggers. While the exact causes of depression can vary, it often results from a combination of genetic, biological, environmental, and psychological factors. Certain life events, such as trauma, loss, or major life changes, can also trigger or exacerbate depression. Depression is a complex mental health condition, and its causes and triggers can vary from person to person. It often results from a combination of factors, which may include 1. Biological factors, brain chemistry, imbalances in neurotransmitters, chemical messengers in the brain, such as serotonin, dopamine, and norepinephrine, can contribute to depression. Genetics, a family history of depression may increase one's susceptibility to the condition, suggesting a genetic component. 2. Psychological factors, trauma, past traumatic experiences, such as abuse, neglect, or loss, can be significant triggers for depression. Stress, ongoing stressors, like work-related stress, financial difficulties, or academic pressure, can contribute to the development of depression. Personality, certain personality traits, such as low self-esteem or pessimism, can make individuals more vulnerable to depression. 3. Environmental factors, life events, significant life changes, such as the death of a loved one, divorce, or major life transitions, can trigger depressive episodes. Chronic illness. Managing a chronic illness can lead to feelings of hopelessness and contribute to depression. Substance abuse. Substance abuse, including alcohol and drug misuse, can both trigger and worsen depressive symptoms. 4. Social and interpersonal factors. Isolation. Social isolation or a lack of social support can increase the risk of depression. Relationship problems. Strained or unhealthy relationships, including conflicts with family or friends, can be a source of stress and depression. Bullying or discrimination. Experiencing bullying, discrimination, or prejudice can lead to depression, particularly in vulnerable populations. 5. Medical conditions. Certain medical conditions, conditions such as chronic pain, hormonal imbalances, or thyroid disorders, can contribute to depressive symptoms. Medications. Some medications, including certain prescription drugs, can have depression as a side effect. 6. Hormonal changes, hormonal fluctuations. Hormonal changes during pregnancy, postpartum, menopause, or as a result of thyroid disorders can trigger or exacerbate depression. 7. Substance use, alcohol and drug use. Substance abuse can both trigger and worsen depressive symptoms. It's essential to understand that depression is not solely the result of one specific cause, but rather a complex interplay of various factors. Additionally, not everyone exposed to these factors will develop depression, and some individuals may experience depression without clear, identifiable triggers. Seeking professional help from a mental health provider is crucial for a comprehensive evaluation and appropriate treatment if you or someone you know is experiencing depression. Segment 4. Seeking help. If you or someone you know is experiencing depression, it's crucial to seek help. You don't have to face it alone. Reach out to a mental health professional such as a therapist or psychiatrist. They can provide guidance, therapy, and potentially medication to help manage symptoms. Seeking help for depression is a critical step towards managing and recovering from this mental health condition. Here are some important steps to consider if you or someone you know is dealing with depression. 1. Talk to a mental health professional, therapist or counselor. A licensed therapist or counselor can provide talk therapy, psychotherapy, to help you understand and manage your depression. Psychiatrist. If your depression is severe or if medication may be necessary, consult a psychiatrist. They can prescribe and monitor the use of antidepressant medications. 2. Reach out to a general practitioner. Your primary care doctor can be an essential first step in diagnosing and managing depression. They can provide referrals to mental health specialists if needed. 3. Open up to friends and family. Share your feelings and experiences with trusted friends and family members. Their support can be invaluable during your recovery journey. 4. Crisis helplines. In a crisis, or if you're experiencing thoughts of self-harm or suicide, reach out to a crisis helpline immediately. In the United States, you can contact the National Suicide Prevention Lifeline at 1-800-273-TALK, 1-800-273-8255. 5. Support groups. Consider joining a local or online support group for individuals with depression. Sharing experiences and coping strategies with others who understand what you're going through can be comforting. 6. Self-help strategies. While not a substitute for professional help, self-help strategies like exercise, maintaining a balanced diet, practicing relaxation techniques and mindfulness meditation can complement therapy and medication. 7. Set realistic goals. Break down tasks into manageable steps and set achievable goals. Celebrate small accomplishments along the way. 8. Stay connected. Depression often leads to social withdrawal, but maintaining connections with friends and family can provide emotional support. 9. Educate yourself. Learn more about depression to better understand your condition. Knowledge can empower you and help you make informed decisions. 10. Follow your treatment plan. A. If prescribed medication, take it as directed by your healthcare provider. Attend therapy sessions consistently and actively engage in the treatment process. I. 11. Monitor your progress. B. Keep a journal or use mental health apps to track your mood and symptoms. Share this information with your healthcare provider to adjust your treatment plan as needed. 12. Be patient. C. Recovery from depression takes time, and there may be ups and downs along the way. Be patient with yourself and seek support when needed. Remember that you are not alone, and there is help available. Depression is a treatable condition, and many individuals experience significant improvements in their mental health with the right treatment and support. The first step is reaching out for help and seeking the guidance of mental health professionals. Segment 5. Self-care and coping strategies. In addition to professional help, there are several self-care and coping strategies that can be beneficial. These include regular exercise, maintaining a balanced diet, getting enough sleep, practicing mindfulness and relaxation techniques, and connecting with supportive friends and family. Self-care and coping strategies are essential for managing depression and improving your overall well-being. While they should not replace professional treatment, they can complement it and help you cope with the challenges of depression. Here are some self-care and coping strategies to consider. 1. Regular exercise. Engage in physical activities like walking, jogging, yoga, or dancing. Exercise releases endorphins, which can improve your mood and reduce symptoms of depression. 2. Healthy diet. Maintain a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Proper nutrition can support your physical and mental health. 3. Adequate sleep. Ensure you get enough quality sleep. Establish a regular sleep schedule and create a comfortable sleep environment. 4. Stress management. Practice stress reduction techniques such as deep breathing, meditation, progressive muscle relaxation, or mindfulness. These methods can help reduce anxiety and stress, common in depression. 5. Limit alcohol and caffeine. Reduce or eliminate the consumption of alcohol and caffeine, as they can worsen depression symptoms and disrupt sleep. 6. Set realistic goals. Break tasks into small, achievable goals. This can provide a sense of accomplishment and help counter feelings of hopelessness. 7. Daily routine. Establish a daily routine that includes regular meal times, exercise, and consistent sleep patterns. Routine can add structure to your day, which can be helpful when dealing with depression. 8. Avoid isolation. Make an effort to maintain social connections with friends and family. Even brief interactions can provide emotional support. 9. Limit negative self-talk. Challenge negative thoughts and self-criticism. Replace them with more balanced and positive affirmations. 10. Engage in enjoyable activities. Participate in activities you once enjoyed, even if you don't initially feel like it. Over time, this can help improve your mood. 11. Express yourself. Use creative outlets like writing, art, music, or journaling to express your feelings and thoughts. 12. Seek support. Lean on your support system. Share your experiences with trusted friends and family members who can provide emotional support and understanding. 13. Limit stressors. Identify and reduce sources of stress in your life when possible. This might involve setting boundaries, simplifying your schedule, or seeking help with tasks. 14. Stay informed. Educate yourself about depression and its treatment options. Understanding your condition can empower you to make informed decisions about your care. 15. Professional help. Continue to engage in therapy or counseling sessions, as recommended by your mental health professional. Medication, if prescribed, should also be taken as directed. Remember that self-care is an ongoing process, and what works best for you may evolve over time. It's essential to be patient with yourself and seek professional help when needed. Self-care strategies, when practiced consistently, can help you manage depression symptoms and improve your quality of life. Segment 6. Breaking the stigma. One of the most significant challenges in dealing with depression is the stigma surrounding mental health. It's essential to break this stigma and encourage open, non-judgmental conversations about mental health. Let's support each other, be compassionate, and create safe spaces for those who need to talk. Breaking the stigma surrounding depression and mental health is crucial for creating a more compassionate and supportive society. Stigma can discourage individuals from seeking help and make them feel isolated and ashamed. Here are some ways to help break the stigma associated with depression. 1. Education and awareness. Start by educating yourself about depression and mental health. Knowledge is a powerful tool in challenging misconceptions. 2. Open conversations. Initiate open and non-judgmental conversations about mental health with friends, family, and colleagues. Encourage others to share their experiences and feelings. 3. Share personal stories. If you feel comfortable, share your own experiences with depression or mental health challenges. Personal stories can humanize the issue and inspire empathy. 4. Challenge stereotypes. Challenge stereotypes and misconceptions about mental health whenever you encounter them. Correct misinformation and promote accurate understanding. 5. Supportive language. Be mindful of the language you use when discussing mental health. Avoid stigmatizing language and be sensitive to the words you choose. 6. Advocate for change. Advocate for mental health awareness and support in your community, workplace, or school. Encourage policies that prioritize mental well-being. 7. Media representation. Encourage responsible and accurate portrayals of mental health in the media. Advocate for more realistic and empathetic depictions. 8. Mental health first aid. Consider taking a mental health first aid course to learn how to provide initial support to someone experiencing a mental health crisis. 9. Promote professional help. Emphasize the importance of seeking professional help for mental health issues, just as one would for physical health. 10. Create safe spaces. Foster a safe and non-judgmental environment where individuals feel comfortable discussing their mental health. 11. Encourage self-care. Promote self-care practices and stress the importance of well-being, both mentally and physically. 12. Normalize seeking help. Emphasize that seeking help for mental health concerns is a sign of strength, not weakness. Normalize therapy and counseling as valuable resources. 13. Celebrities and public figures. Support public figures who openly discuss their experiences with mental health. Their influence can reduce stigma on a larger scale. 14. Supportive community. Engage in or create local or online support groups where people can connect with others facing similar challenges. 15. Listen actively. When someone shares their mental health struggles, listen without judgment and offer support. Sometimes, all someone needs is a caring ear. Breaking the stigma surrounding depression and mental health is an ongoing process that requires the collective efforts of individuals, communities, and society as a whole. By fostering understanding, empathy, and open dialogue, we can create an environment where those affected by depression feel validated, supported, and empowered to seek the help they need. Segment 7. Stories of hope and recovery. To provide hope and inspiration, I want to share stories of individuals who have faced depression and come out stronger. Their journeys remind us that recovery is possible. I'll hear a few stories of hope and recovery. 1. Jenny's journey to healing. Jenny experienced severe depression in her late 20s, which led to feelings of hopelessness and isolation. With the support of her family and a skilled therapist, she began attending therapy sessions regularly. Over time, she learned coping strategies, regained her sense of purpose, and eventually returned to work. Jenny's story illustrates that recovery is possible, even in the face of intense depression. 2. Mark's triumph over depression. Mark struggled with depression for many years, leading to a cycle of self-doubt and despair. After reaching out to a psychiatrist, he was prescribed medication that helped stabilize his mood. With therapy and medication combined, Mark gradually improved. He also found solace in mindfulness practices and began volunteering to help others. Mark's story emphasizes the importance of a comprehensive approach to recovery. 3. Sarah's journey to self-discovery. Sarah's depression emerged during her teenage years and affected her relationships, academics, and self-esteem. She decided to seek professional help and underwent therapy to address her underlying issues. As Sarah gained insight into her emotions and learned healthier coping mechanisms, she experienced a transformation in her life. She pursued her passion for art, strengthened her relationships, and achieved her academic goals. Sarah's story showcases the transformative power of therapy and self-discovery. 4. Michael's resilience in adversity. Life. She sought help from a therapist who specialized in adolescent mental health. Through therapy, Ella learned to manage her depression and developed a strong support system. She eventually pursued higher education and became an advocate for mental health awareness. Ella's story illustrates how early intervention and support can lead to recovery and resilience. These stories of hope and recovery demonstrate that individuals with depression can find their way to healing, growth, and a brighter future. While everyone's journey is unique, these narratives emphasize the importance of seeking help, building a support network, and using a combination of strategies to overcome depression. They serve as a reminder that recovery is possible and that there is hope for those facing depression. Segment 8. Conclusion and resources. As we wrap up this discussion on depression, I want to remind you that you are not alone and there is help and support available. If you or someone you know is struggling with depression, please don't hesitate to seek professional help. I've included some resources in the video description below. Thank you for joining me in this important conversation today. If you found this video helpful or informative, please like and share it to help spread awareness about depression. Let's continue to support each other and work towards a world where mental health is treated with the same importance as physical health. Take care and remember, there is always hope. Until next time.